I will start the recording now. Okay, so welcome to everybody again. Today we're joined by three fantastic guests. We have Olivia Tulloch, who will be presenting on the principles for engaging with communities during crises. And Olivia is the CEO of Anthropologica, which is a research-based organization that's specializing in applied anthropology for global health. Olivia has been leading Anthropologica's emergency response work since the start of the COVID-19 pandemic. And with the Social Science and Humanitarian Action Platform, or otherwise known as SHAP, she has been providing strategic and technical guidance on humanitarian and disease outbreak response. She's got over 20 years experience bridging academic research, operational research and technical assistance. And today she'll be talking about the principles of engaging with communities in humanitarian response. And then following on from Olivia, we'll have an example of a tool used for community engagement, which will be presented by Raisa Azzolini from Oxfam. If we can get her to join today's session, because she's having some problems logging in, so fingers crossed we will be able to find her. And Raisa has been working with Oxfam for over 20 years in the public health, she's worked for over 20 years in the public health humanitarian sector, responding first of all with Médecins Sans Frontières, and then has supported the global public health promotion team when it became apparent that we needed more public health promotion and more focus on the softer side of WASH responses. She joined Oxfam in 2010 as part of their surge response team, and she's now an advisor in the global humanitarian team. She has a strong passion for community engagement, and she's been leading Oxfam's community perception tracker approach. And then following on from Raisa, we'll have a presentation from Ombretta Baggio, looking at the IFRC community feedback responses and their learning from Ebola and COVID-19. So Ombretta has been a passionate campaigner of the need to work collaboratively with communities on community-led humanitarian and health programming approaches. She is currently working with the IFRC as a community engagement senior advisor, and she was responsible for launching the groundbreaking partnerships such as the Collective Service for Risk Communication and Community Engagement. She's led the development of different community feedback approaches, different guidance and capacity strengthening initiatives at local and global levels to enable participation of communities and local actors in health programming and humanitarian responses. And she will be joined by Gillian McKay, who is the Humanitarian Health Research Advisor for ELRA, and who was working on this topic with London School of Hygiene and Tropical Medicine. Okay, so that's all the introductions done. I will now hand over to Olivia for our first presentation, but just a reminder to everybody to please do add your comments and questions into the chat box as we go through today. We will have lots of time at the end of today's session for questions and answers, but please do note them down in the chat box and that will help us moderate them towards the end. Okay, so over to you, Olivia. Thank you. Oh, I'm not sure we can hear you yet, Olivia. Don't know whether you're just sorting out slides.
I was indeed just sorting out slides. Sorry about that. I started talking and realized I was on mute. Thank you very much for the introduction. So yeah, as explained, I'm really just talking about the principles for engaging with communities during crises. I'm assuming that you all know that you're all doing this to some extent in your daily work, but so this is to some extent a recap of what some of you might know, but really to set the foundations for the rest of the discussions that will follow. As was explained in the introduction, I work for Anthropologica, and a lot of what we do is in support of community engagement initiatives. We do that across multiple health emergencies, as well as through SHAP. So just to start with the overview, community engagement in its broadest sense is a term that encompasses a great many approaches, and that they really aim to work collaboratively with communities in order to bring about positive change. There's historically been a lot of overlap in terms with community engagement. There are lots of acronyms, some of which you will see on the slide here. And they are used across the humanitarian community. Different organizations use different acronyms. And so these other related approaches incorporate risk communication. They might get called communication for development, and so on. I won't go into the distinctions between these different techniques and approaches, but I just want you to be aware that different agencies and organizations use different terms. But to my mind, the most important thing is that partners agree on the shared principles about how engagement with communities takes place, and that communities are really always staying at the center of our responses and are driving the work that we do. So in terms of the guiding principles for engaging with communities, there are a number of these, and the ones that I've used here are really drawn from a report that Anthropologica did in collaboration with the IFRC. So Umberta, you'll be very familiar with this. And I've really taken the principles that we set out in that report, and it was for the Global Preparedness and Monitoring Board. So I'll start with partnering with communities and how important it is to do that in order to achieve shared goals, and that communities aren't just beneficiaries or recipients of a service, but they're also the first responders. And so we must partner with them in order to capitalize on their resilience and their resourcefulness. And next is to build on existing knowledge, skills, structures. That's recognizing that communities have existing capacity. They have knowledge too that is relevant to the response work that we do. And so our responsibility is to identify those collaboratively and support that capacity, whilst working to try to overcome gaps or weaknesses. And mechanisms that exist may have developed over time and as a result of previous crises or shocks. And it's really important for us to understand that. Next is to work with and through existing structures and practices, rather than doing something which is temporary or ad hoc. And then recognizing that communities have their own valid priorities, which might not necessarily be in the front of our minds as responders. So an integrated and humanitarian response doesn't only look at what the current crisis is, but what other community needs might be. So it might be related to child protection or WASH issues or mental health and psychosocial support. And often for them, for the people we're working with, those issues might be more important in their mind than the issue that we are responding to. And I can give some examples of these if we've got time later, but I'm aware we're a bit limited. I've got lots of examples. Then the next is to facilitate participation and to empower communities. So where we recognize that there's a gap in capacity within a community, then really to genuinely lead preparedness and response activities without external guidance. We can take the role of facilitators. So putting the community in the leading role, and we facilitate that leading role. And that could be in the process of designing interventions, of planning, of implementing, and evaluating, and so on. There are lots of different participatory methods that have been developed and are well documented. We can talk about a few in a moment that can help the planning and the design of community-led action. And again, I've got some examples of those. Then to continue with this next set of guiding principles is first on this slide is building two-way trust. So that means that whilst recognizing that communities need to trust preparedness and response measures to be effective, we as external actors also really need to trust the communities that we're working with in order that good decisions are made. So making sure there is meaningful two-way communication, learning to compromise our ideas, facilitating shared decision-making, having bilateral accountability. Those kinds of things are really important. Whereas, and perhaps it's obvious, but things like coercive strategies and censorship of controversial issues really should be avoided. Then there's the understanding of context and making sure we adapt. And this is really thinking and recognizing that contexts are so variable in the places where we work. Communities are very complex and also dynamic. So for our engagement with communities to be meaningful, we need to think about what their social realities are, what are the political and the development issues in that place at that time, what are the customs and practices, what languages do people speak, how do people want to be communicated with, or how should communication work? And then next is to think about integrating some social sciences into the way that we work, and ensuring that there are real-time insights from communities. So I'll talk about social science methods, but they can be used to collect data, and I know some of you are going on to talk about how this can be done, and also to verify the data that we need so that program strategies are well informed, but that they should be adapted to fit to changes quickly. And training and working with local communities can be an important way of managing that. Next, it's important to be inclusive, actively seek and involve marginalized people and the most vulnerable people in a community and those who are most at risk of exclusion. If you don't think about the complexity and the makeup of a community when designing an integration, an intervention, then the consequences can be quite harmful. Then we should think about humanizing our work. So that's thinking about the psychosocial implications of a crisis or an emergency, and the impact that has on both responders, but most importantly, the wider community as well, and integrating psychosocial principles into the work that we do. How am I doing for time? I think have I gone over already? Or are we okay for a couple of minutes?
I think you're okay.
Okay.
Yeah, go ahead.
I've got a slide up here about the role of social science then, and how that can help our work, and the sorts of ways in which we might use social sciences when we're thinking about engaging communities. So one of those is to use particularly qualitative but also quantitative methods to provide information that is incorporated into our work, to think about the realities and priorities and attributes of the people that I was just describing. And in order to do this, there are things we might do like mapping how people want to be communicated with, what existing ways of communication there are. There's the building the communication channels, there's making sure there's the participation so that we can understand the problems that we have and so on. So the principles that I was just explaining can all be underpinned with social science and social and behavioural research to help guide the work that we do in the WASH sector and across the humanitarian sector. Okay, so in terms of specific lessons for WASH, and I'm not coming from the WASH sector, but the things that would certainly be applicable then is making sure that we are really engaging community leaders and influencers and recognizing them as critical enablers to promote positive WASH practices. So that might be religious leaders, traditional healers, women's groups, and so on. And then making sure that our interactions and consultations are ongoing, and that they happen with diverse communities. So that's thinking about the vulnerable and the marginalized populations that I already met, and that can then help us to tweak and improve the quality of the WASH services that we are working to deliver. Better contextual information will be as important in the WASH sector as in any other crisis work that we do, and that can help us to work out who are the most important formal and informal stakeholders, who are the trusted information sources, and who are the service providers, for example, working and who are relevant to WASH programming in the places where you're working. And then again, as important as in other activities, making sure we have the cultural and the religious beliefs of the populations that we work with taken into account when we design our programs, so that we don't undermine people's normal practices in the work that we're trying to promote, or the activities we're trying to promote. And if you involve community members in your monitoring and evaluation of your WASH programming, then you can be sure that you can continue to adapt those programs with their concerns and considerations. Then measuring community participation will help us to understand the effectiveness of the WASH programming, or the approaches that you are adopting, and help us to motivate and support changes in behaviour where we want to see that. And then if we communicate the information clearly and in the appropriate languages, we should be able to reach all members of communities. I've just put as my final slide some lessons from WASH, which is from Oxfam program, because I know that we are going to have some lessons from Oxfam, but I think I'll probably let Raisa sort of focus in on that if she's managed to join us, and stop before I've been too slow. Here are some key resources should you need them, and welcome to reach out to me with any questions if you have them. Thank you very much.
Excellent. Thank you so much, Olivia. Unfortunately, Raisa has not been able to join. I think, unfortunately, because we had some problems with the registration link, it's blocked her from being able to access again. But what I will do instead is just show a short video summary that we have about the Oxfam Community Perception Tracker, which is Raisa also presenting, but will be on a video, so apologies for that. But just before I show that, please do add any questions that you have for Olivia into the chat box, and we will make sure that we come on to these at the end of the presentations. So bear with me one moment and I will just make sure I can share this one with you all. Okay, and hopefully now we can make this bigger.
I'm Raisa Azzolini, the CPT coordinator for Oxfam, and I'm here to introduce you to the Community Perception Tracker, CPT, a new approach that we've used in the field throughout COVID-19. So there's a huge amount to say about the CPT, but here's going to be a really brief snapshot of what it is, how it works, and some lesson learned along the way. There's a lot more information on our dedicated CPT webpage, the link at the bottom of the poster, which includes some full case studies. And later this week, you will hear also from the London School of Hygiene and Tropical Medicine, some great learnings from our research project on the CPT. So the CPT is very much part of our Oxfam community engagement approach. It was developed in 2018 and tried in DRC during the Ebola outbreak. And then it was adapted to COVID-19 last year and implemented across 5 different regions. The important thing to note about the CPT is that it's not a standalone approach. It should be implementing alongside existing program activities.
I'm actually going, sorry for this, I'm actually going to pause that there because I see Risa has just been able to join. So Risa, we did an emergency inclusion of your recording. Do you need a few minutes? You're just on mute.
Never tried to join a global webinar from Ukraine. I think it's just absolutely impossible. They didn't want to recognize me. Sorry, I apologize.
So shall I hand straight over to you? Is that okay? Let me just stop sharing my screen here and I can hand over to you.
Let me just try to see if I can share. Wait, sorry. Oh.
Excellent. Yeah, it's coming up.
I apologize for that. Hopefully you'll see something coming up.
Yes, it's there.
So,
wonderful.
Hi everyone.
Thanks, Risa.
So I'm not sure where you were and what you said, but I'm going to try to stick to the time, to the 10 minutes you give me, Michelle, and I'm going to speak about the community perception tracker. So I think there was a recognition in our sector and beyond our sector that community engagement is vital for effective programming, but it's not necessarily done systematically, and it doesn't systematically lead to improving our programming. So that was something we discussed many years ago, and for that we developed the community perception tracker, who was definitely addressed to those several long-standing challenges in disease outbreak. So we developed it in 2017, we piloted in 2018 in the Ebola outbreak in DRC, and then extensively during the pandemic in between 2022, sorry. We implemented in 15 countries, and I'm not sure who is in the webinar today, but we also trained ACF, Action Against Hunger, who also use it in other 2 countries. So what is the purpose? And I'll go into details a little bit more about how it works, but what it was really the purpose at the beginning was basically 4 main objectives. By listening to people, and I explained how the CPT works, we were able to collect systematically or capture systematically qualitative information coming from communities to better document ongoing context analysis. So that was one of the objectives really throughout the outbreak, to be able to update our context analysis. It was also to adapt our programming. So based on what people were telling us throughout the program, how to adapt based on what we were listening, or to use this information to advocate. So sometimes where we're not be able to address certain issues, to be able to go to other organization, partners, government, NGOs, etc., or just to advocate on behalf of the communities. And the 4th one was really looking at retrospectively, we could really understand as well what was the change in people perception during disease outbreak. So, and that's something definitely that we say really clearly during the COVID pandemic, because of all the changes throughout the 2 years of what people were telling us, what people were sharing. So this is important also to note that all the information we've been collecting from communities are also kind of used and analyzed in correlation with epidemiological data, but also all sorts of information that we're having from our program monitoring and our MEAL team as well. So what is the CPT? It's an approach that uses a mobile tool to enable the staff or other partners to capture, to analyze, understand the perception of community during disease outbreak, and to be able to use that information to adapt the programming. And apologies for the background noise. Basically, it's embedded in our community engagement approach. It's an ongoing data collection throughout the whole response. So it really goes along the activities that we're having. And it's based on active listening. So basically, it's not a questionnaire, it's not a focus group discussion, and we don't have specific question when we use it. So really throughout the activity, as you engage with the conversation with different people, you might be able to say, well, this is a perception, and it's something that we'd like to capture, and obviously you have to ask consent for that. But there's not a list of questions that we often have when we have questionnaires. It provides qualitative data. And so that was also very interesting, and there was a lot of learning of how our teams are not necessarily confident or geared up to do the analysis of the qualitative data, and how we had to support the team throughout. And it's a multi-sector approach. I know here we're talking mainly about WASH, but it's something really that we really try to export in all the sectors working with us. So just to say that a perception is any questions, any beliefs, concerns, or practices that are in relation to the views and perspective that arise in line with the spread of the disease. So that's quite important, because that's the thing that we try to focus on when we train the team about what is a perception, rather than just what is a message that people are delivering because we just had on, for example, the hygiene promotion session. So there's a process. I won't go into details in the process, but there's definitely a process when the team is out in the field, collects the information. All the information goes into a platform. So we are using here Servicity, or you could use Kobo, something else. Then we have to do the analysis of the data, and then meet with all the people who are using the device and collect information. It's quite important if we manage to have a regular meeting with everyone and kind of present the findings. And sometimes it's a weekly, sometimes it's bi-weekly. So having those regular meetings, and if possible with the different sectors, is important. Triangulate information as well when we have coordination mechanism, obviously, and other organizations' information. And then we adapt the activity, which is really important, or we advocate on behalf of community, and we do a follow-up on the activities that have been obviously changed, or new program have come up throughout the program. So here maybe just a few things. So in terms of different programmatic changes due to the CPT, and what we learned from throughout the especially Ebola outbreak and COVID-19 pandemic, was that there was some regular adaptation, especially on with our PHP team, on the messagings that we were having, or the way we were actually sharing those messages. There was some changes in some of the NFI's distribution that we have been doing. It has also informed new projects, and I'll take an example of Lebanon. During the COVID-19, it has also encouraged the teams to look at how to engage with different a group of people. I mean, there's a place where you explain in terms of gender and age group, and the perception coming from, but also if people are living with disabilities. And we noticed that our teams were not necessarily engaging with older people or people living with disabilities. So that was good to have that information documented, so we could have those discussions within the team. And it definitely increased the collaboration between the different sectors, especially during the pandemic between the PHPs and the protection team. So just a quick example, and I think Jenny should be on the call because she might recognize that. That's just a quick one. Like we worked quite a lot with the Lebanon team for 2 years, and very early on, they were able to see some perception coming up in 2020 and in 21, sorry, and they were able to decide to, based on those perceptions, to design a new project, a completely new project, really on vaccine promotion. Even before actually that the government has completely rolled out the vaccination. And then we also got a lot of information, and it was not just about misunderstanding what was vaccine or having different conception about the vaccine and a lot of fears, but it was also really around people not getting the means to go to the health centers, or because if you had to register on the platform, you could actually, it was all in English, so they were not able to register. So it really did help to shape the programming and beyond just looking at providing just public health messages. I won't go into detail there, but if you do have questions, I'm happy to say a little bit more. And in the course of the 2020 and 21, we also collaborated with the London School of Hygiene and Tropical Medicine, with ACF, and with all the partners we had in Lebanon and in Zimbabwe. We did a research funded by ELHA, and it was really to look at the effectiveness of this approach supporting the COVID-19. So really looking at if by using the CPT was actually making a difference, if our teams were able to adapt our intervention, and if it had actually increased the quality. And then we looked at the CPT user perspective, but we also looked at the community perspective. So I just wanted to maybe highlight a few things that staff and partners have been sharing throughout this research. They've seen the CPT being feasible and take less time than what was expected, even though at the beginning it was really difficult for people to move from I do a survey and ask a lot of questions to I don't ask questions, but I listen more. So that was the tricky part. And I'm also looking at how to classify this information. That's the thing that we ask our team to do. So it was a little bit of practice at the beginning. It did help the staff to develop a closer relationship with communities, and it allowed them, and that's the way they felt, to be more systematic about community engagement. Even though there was a lot of competing priorities with the outbreak, and they had a lot of things, so sometimes there was maybe less perception collected than other times. And it definitely allowed us as well, the staff, to advocate on behalf of the communities. There's a lot of learnings. I think the next step for us is really to document the learning. So there will be an article published probably in the course of this year, towards the end of this year or early next year, with the London School of Hygiene and Tropical Medicine and ACF and Oxfam. Definitely at the moment we're piloting the CPT beyond this outbreak in different countries, in different parts of the world. And there will be a lot of learning as well on that front. And we continue to develop some materials to improve the process and also to improve the monitoring, which is another big thing that we need to work on. And that's it.
Excellent. Thanks so much, Raisa. And thank you very much for being able to jump straight into the presentation when you were able to join the Zoom. Apologies for the issues with the registration link there. So we are going to move straight ahead, and we're going to move on now to Umberta and Gillian. So I will pass over to you both to take us from here.
Michelle, can you hear me?
Yes, we can hear you fine now.
Fantastic. So great to be here with you. Thanks all. I hope you're not too tired. It's going to be 3 in a row, but I'm sure I hope we're going to get to a very interesting discussion after this. So Gillian and I, can you see my opening slide? Yeah.
Yes, all fine. Yeah.
Okay, so Gillian will be there for responding to your questions in the conversation. I'll present the slides. Just to say, the idea here is to share our learnings around community feedback. Gillian McKay, which is a research fellow with the London School of Hygiene and Tropical Medicine, now working with Ella. She's being the lead researcher for the research that I will present later, which is on our Ebola experience. So going quickly into what we've learned over time in terms of community engagement, and really is, okay, so it's very aligned to all that Raisa and Olivia said so far. Community engagement is really around shaping and creating partnerships with the communities, working collaboratively with the community. And this needs joint accountability, which Olivia talked about two-way trust. So it means that we need to change the same way we're asking communities to change. And this joint accountability is very relevant to ensure that there is ownership of the solutions we both agree to take. It's about learning, it's about community feedback being an essential form of evidence. And I'm really glad I'm here with Raisa and the great perceptions tracker solutions that you found in Oxfam. I will present another type of community feedback, but it's really what Gillian has found in her research with us is that it is an essential form of evidence and is essential to promote change and should be normalized. Normalized means that it needs to be part and parcel of the way we operate and needs to be embedded into monitoring systems because it helps us shaping an effective response. But the third lesson is if we want to do that, it means that we need to invest in it. We need to sustain those feedback approaches. We need coordinated effort to do that. We need to do that with other players in the field, like we try to do in Ebola. We've done that in COVID. It needs financial sustainability and long-term support. So we cannot find ourselves, like it happened in Ebola, to set up a feedback mechanism and go to scale with it, because it takes a lot from the operations team in terms of time and investment. So we need to build those data infrastructures before an outbreak happens. For us, the community feedback is really part of a community engagement cycle. So I'm having issues with the PowerPoint now. Is very much part of the community engagement cycle, which is for us encompasses multiple approaches and is about working collaboratively with the communities. But I want you to retain some words here, and you'll be familiar with that. The WASH teams that do amazing community engagement approaches. You have different tools and ways of doing things, but what we've really learned is about this collaboration with the communities is this iterative process. So it's about understanding context, understanding fears, understanding concerns, and building this and shaping the interventions in an iterative process. And doesn't mean that we're going to go with an intervention based on contextual analysis and never change it again. But exactly what we've learned in Ebola is that our interventions, our humanitarian programming needs to change over time because people are changing over time, because they demand different types of interventions. And this comes back so much with the feedback data. So our approach is really grounded into communication, feedback, and the participation elements. And I saw a question in the chat about that, and I'm happy to have a discussion around what we mean by engagement, by participation, because we're using different words in our programming. So what do we mean by feedback? And Raisa started speaking about that. So for us, feedback is really any insights generated by community members. And this includes any type of information, can be shared as questions, suggestions, observations, can include sensitive feedback, such as complaints, can include rumors and misinformation. So it's very important that we move away from thinking that feedback is all about rumors. And we've seen that in Ebola so much. Rumors place a negative connotation to what community is sharing with us. It is a way for them to read a situation where there are things that they don't understand. So we need to really pay attention to the type of questions they're asking. And for me, the questions were the most relevant to really shaping the work we were doing. It's about, yeah, as I said, any type of information about their experience of the humanitarian system or specific topics. And it could be a feedback around our work, or feedback around something that is of concern to them. And last but not least, it can be received through different channels. It can be an app, an innovative solutions to capture feedback, but it can also be a more informal way of sharing, unstructured way. And what I will be presenting today is more that capturing the feedback in a unstructured way, pen and paper, writing down during conversations what people are saying. So it can really be in different forms and things. So exactly what we did in the Ebola outbreak. So I want to take you now to Goma, North Kivu, Ituri. The Ebola outbreak were back in 2018, unfortunately, one of the second largest Ebola outbreak. And here we are, where we are struggling to understand what's happening on the ground. Aid workers are struggling to contain the outbreak. People are refusing vaccines. They're not going to the treatment center. They are attacking treatment centers. And we found ourselves trying to understand what's happening. What are the perceptions in the communities? Why are they attacking us? Why are they blocking us? And this is a new approach that started exactly at that time. And we were lucky to have the support from CDC to do so. They help us with the methodology and help us in really having a sound and way of analyzing this data. And we were able to scale it up pretty quickly, go to app. We collected more than 300,000 data points, so feedback data points across the region in different provinces, in different districts between 2018 and 2020. And then and we had 800 volunteers capturing this data in the 29 health zones. So the largest ever feedback mechanism that we were able to set up. So I want you to land in Butembo now in 2018. And this is where we started really understanding what was happening. Our teams doing safety identified barriers were blocked from accessing houses, accessing communities, and feedback and comments about safety identified barrier was the highest category. This is one of the ways we found to share the feedback data with other partners and agencies that were facing the same issues that we were facing. So really quantifying and coding the data in a way that could speak to the stakeholders, to the leadership that was that needed to change programming. But what happened So what we did was not really a bar chart, but we were extracting quotes, the most relevant quotes about what people were saying. So what people were saying was that our team was cutting parts of the body when they were doing the safe and dignified burial. The people in the bags, in the white bags, were not their people, or they were still alive when we were putting them into the bags. So, and then that we were actually burying the stones and selling parts of the body. So this was the situation. It was important for us to understand what people were feeling, thinking, and saying about our work, so that we could shape in a way that could respond to their concerns. It was this, as I said, was the situation overall. It wasn't only with our work in the safe and dignified burial space, but people were attacking health workers, were attacking treatment centers, not letting the team. And this is the treatment center in Butembo that was attacked in 2019. So this was another way that we found to share the data and the trends that we were seeing in the data. And just to show you, it was a thorough type of work, so that we could really go to the different team working on the pillars of their response, such as vaccines, to say, your area of work is the one that has the most worries and concerns in the communities. And they were suggesting a number of changes, and they were suggesting they had concerns and confusion around targeting, for example, around vaccines. And I want just to share here that the burials concerns around burials and questions around burials, they decline over time. And we were able to go from a peak in time in 2018 to having that flattening over time 2019. And we were able also to increase the acceptance rate. So we went from 79% of refusal of our teams to basically bury their loved ones, to an 8% refusal in a matter of 6 months. That was quite an achievement for us, and this was done for understanding really the concerns of the people and engaging them in a different way. So I want to just say the different talk about the different multiple level we can operate. And I want to give the message that the feedback is, of course, we have times where we have more capacity, we can scale up quickly and work at the very different levels. So work the feedback and change things at the more local level, which is working with the communities in their communities. But it can be, and this can be done in very simple ways. And it can be also working more at the interagency level, like we've done in COVID, at the more regional level, to really cluster feedback coming from different parts of different countries, and then clustering trends around feedback, so that we shape the way the regional stakeholders were operating. And these are the different multiple levels we've operated. So going quickly into the research. The research from the London School was to understand how the new community feedback system was used to make operational and strategic decisions. And the method that Gillian and the team used around that was qualitative data collection that was done in 2019 in Goma and Beni. And there is an article, Gillian, if you have the time to share that, it would be great to have it, but you'll have it in the presentation. So some of the key findings that came out of that. Some of the challenging parts is that often each of our organizations, they are concerned about the branding of the data, branding the evidence. So who's providing this data sometimes becomes too important for organizations, to the point that they might neglect the feedback that is coming out from another organization such as the I4C. We were offering this feedback at scale to the interagency response, and it was like the first time we really had quite a substantive amount of data that should have been used by all the partners. It wasn't data only for the Red Cross, it was data for everybody. But sometimes our branding hinder us from using others' data. There is also a qualitative data stream barrier. So we work with experts that are expert in quantitative data. They are quantitatively trained, and some of our qualitative data comes to them as something that might be dismissed by the clinicians, and finding ways to share this data in a way that it can understand better was the type of journey that we did. In Ebola, like in COVID, I think we were also all overwhelmed with the amount of data we were facing. So often, the decision makers, the stakeholders on the ground, the government is overwhelmed by many data. So we need to make sure that we have a way to cross-analyze this data, go to stakeholders with a more organized way to share this data. And this has been one of the challenges that we've seen in the field. Opportunities. The opportunities that we've seen and we've learned a lot from that was co-creating recommendations with the decision makers. It means that we shouldn't be shaping the recommendations in our office, but really discussing, which is what we did, discussing with pillars of the response, with other stakeholders that are in the humanitarian response, and is very important to ensure ownership. And then acting on community feedback builds ownership, and we've seen that over and over. So I will never get tired to say that people are not tired of providing feedback. People are tired of us not using that feedback. So we need to find ways in which we demonstrate our accountability and act on what's coming our way, and that needs to be communicating to the people and be discussed with the people. And this builds acceptance, but also ownership for them to take the actions that is more their responsibility. So final recommendations from that has been that community feedback has come out from this study is that community feedback should be rolled out in future outbreaks. It is, of course, it depends on the capacity we have. The scale can be very different and is dependent on the type of resources also we have on the ground. The second recommendation is around community feedback collection, analysis, and interpretation. It's a particular skill set and need to have the appropriate capacity building, and needs to be integrated as early as possible into the operation, because it needs time to be rolled out. We need to test the different type of approaches to presenting this data, and we've tested that during Ebola. That really speaks to some of these experts that are more expert in quantitative data, like the IP data. And then the final one is that where we have multiple data, we need really to triangulate this data, but we don't need to be obsessed to merge all this data together. And this is what happened in Ebola, that there was an obsession in bringing every type of data together, but we have different ways of collecting this data. Sometimes it's not comparable. We cannot triangulate this data. So we need to find ways in the middle of an emergency to triangulate, but not being obsessed. And especially if an organization has this data at scale, use the data of the other organization to really embed and change things into our operations. So from this learning of Ebola, quickly going into what we've done in COVID and in general in our health programming, we've used this data in different ways, and this is what you see here is stage 3, and I'll share but stage 3 of the community feedback process is around sharing and acting on the data. One of the most difficult parts, indeed, is doing something with this data, and for this to happen, we need to, and this is the experience that we've had in Africa in COVID, but also for other type of health programming. We need to really find simple and effective way of sharing and visualizing the data. So you see, for example, the dashboard that we've done in DRC now for a preparedness and response in epidemics project that we have in DRC, well beyond COVID. And then you see also the, for example, the report. I don't have it on the screen, but we've done also reports, including with other agencies, to share the feedback. Responding to it can be a matter of coming up with question and answers, fact sheets. For example, we've done that in COVID with the Ask Dr. Ben and Ask Dr. Aisha, fact sheets and social media videos, but we've transformed it also in frequently asked questions on the ground. But one of the most important part is not only to change what we say, our messaging, but change what we do. And this is what happened, for example, in Ebola. We've changed the body bags to make sure that people could see the face of their loved ones through the body bag. We've changed, we've worked with the health services in Mozambique, DRC, and Guinea to make sure that we were using the feedback to define the locations of the services, the setup, how the service was organized, and then, for example, the kind of staffing that were engaged there. For example, in DRC, they wanted more the local staff and local community level staff to be engaging in the service. Changing who we work with, for example, is a way that we've used the feedback. Working with mototaxi drivers was a key feature in Congo and Sierra Leone because it came back that they were powerful champions of change. Working with religious leaders in Kenya because we found through the feedback that there were extreme religious related beliefs coming through our feedback system. So we work with the religious leaders. And finally, using this type of data for advocating for change, which is what we did in Kenya for influencing the way the quarantine policy in 2020 was changed based on people's voices, which is really powerful. We join other agencies to do so. Okay, so how do we do that? How do we do the feedback? We've spent the past 2 years coming up with the tools and the guidance. So, and the feedback is coming out possibly in the next 2 weeks. 5 modules, 27 tools and templates from how to code the data, how to collect the data, Excel type of tools, really simple. It has the feedback essentials, but also in-depth module, which is the one based on the DRC work. We've done this with CDA, and which is the module how to listen and respond to open community feedback. So unstructured feedback, pen and paper type of feedback, and how you can code and analyze this type of feedback. And then we have a module on how to use perception surveys to collect feedback, for example, or a module on handling feedback. On the right side, you see the stages of the feedback, which is really important for us. Is that, again, iterative process, is around really from the collection to the analysis to the action, which is the most difficult part, closing the loop, and then again reviewing and adapting the way we operate. Critical questions for the discussion. Something we're battling with still is how do we put community perspectives and social science on the front line of emergency response? What are the trade-offs between involving the communities in data generation at a very localized level and high quality data and systems, for example, and then how to bring about a shift in the way we operate to make sure that our system takes into consideration the perspectives of the people in our programming. And that's it for me. Some of the resources for you are in the last slide, and will be with you when we share the presentation. Over to you, Michelle.
Great. Thank you so much, Ambretta. We just have one very short video to show. Unfortunately, our presenter from World Vision, Peter Kainwo, was unable to join with us today, but we have a short video that outlines some of the World Vision work that was done in terms of community engagement with faith leaders. So we'll show this one just now, but we also have Michael Wicker from World Vision with us, who will be able to answer any questions that you might have about the World Vision programme. So just bear with me 1 second while I share this screen. Okay, oh, let me just check. Here we go.
Ndio nasie tukianja gonjwa na bopere akikufa, ndio nilikuwa nasikia baridi. Apre pale nikianja sikia mwili yote naluma, nikianja tapika na kudiare, mwili yote naluma, sijui kama basi ndio sema nini. Tulikuwa 6, 5 ilikufa. 3 ilikufaka na sijui. Mwali nisaidia sana tu ni pastor. Na mbonaka njoo ku kanisa.
Donc World Vision ilikuwa itu solliciter comment tu véhiculer un message pour éviter le soulèvement ya population. D'habitude tulikuwa formé juu ya problème ya sensibilisation juu Ebola. Sawa vile wa pasteur tukakuwa formé na World Vision. Alors pour que World Vision inatupatia ba element ya kutuformer pour que twende tuna divulguer, donc tunafanya campagne juu ya problème ya sensibilisation juu Ebola.
Juu tulikuwa natushakatala natushakatala nishasema se hii haiko Ebola wanatudemba. Juu tulikuwa natushatoka ku hospitali tena tunapata Ebola namna gani? Pastor akitutembelea akituambia Ebola iko. Ndio vile nilienda kudawa, akikuwa nenda niona hata kule kudawa niko na nchapo. Hange kuyaka kumbe sasa nishaka kufa.
Okay, Michael, I don't know whether you wanted to maybe say something just at the end of that video there before we go to questions.
Yeah, sure. So this is a program approach of World Vision called Channels of Hope. And it's basically an approach to engage with the community through faith leaders. And it seemed to be really effective, especially in contexts where there's a lot of distrust of either the local government, the health, the UN, kind of misinformation, conspiracy theories, whatnot, where you can kind of go through trusted faith leaders and to kind of debunk some of the rumors and misinformation. And they also have another video, I'll just post in the clip, where actually you'll have a Christian pastor speaking into a mosque and also an imam speaking to a church, kind of switching congregations. That can also kind of encourage any interreligious fighting, where they're showing they have kind of one goal in mind. So yeah, it's a great approach, and some other good research done by Berkeley and John Hopkins. So I'll drop the links and leave it all to questions. Yeah.
Great. Thanks so much, Michael. Okay, so we've had a couple of questions and comments into the chat box, but please do continue to add your questions in there, or feel free to raise your hand if you have questions. So the first one came from Brian, which was looking at really kind of how we can get some plain English definitions for some of the subsets of community engagement. And I wanted to also kind of build on the first part of his comment as well. So a question for all of our presenters around where can we find those plain English definitions, but also why do we think there is this kind of gap between the why we do community engagement and the how, or the actual implementation of good quality community engagement. So I don't know who would like to take that one first. Maybe, I don't know, Olivia, do you want to take that one?
Hi there. I think in terms of the plain English terminology and the terminology overall, I think that there are several partners who are actually already sort of working on this to make sure that the way that we as agencies or responding partners work on these things is aligned. But actually, I wonder if on Greta it might be better place to answer this, just because I know it's something that the collective service was much engaged with. Umbretta is, I don't know how far that work developed. Do you have any sort of better insight than I do on that?
So there isn't, I mean, just to respond, we don't have an aligned definition across agencies of what community engagement is. And there are different terminologies still floating out there, from accountability to affected population to behavior change, social change, C4D, AAP, you name it. So what is, I think, is we've moved away from finding a common definition, but more aligning on the principles of community engagement. Inside the IFRC, we've taken a stand to define it in plain English, hopefully, and you'll find it in the guide. And is but really spelling out the principles, what we mean by that. So we're also moving away from using acronyms. I'm into an acronym fatigue kind of mode, and I don't want to use acronyms anymore. And I hope we will move away from using acronyms. For us, community engagement is around working in partnership, is around participation, is around listening, and it is around collaborating with the communities. How we do that? We know how to do that. We've done that in many ways. But what needs to be clear is that it needs funding, it needs resources in terms of, it's very intense in terms of human resources. It needs buy-in from the organization, and it needs a rethinking of the power dynamics. So if you really want to do community engagement, you need to be open to change, and sometimes our organization are not.
Great. Olivia, do you want to go ahead?
Yeah, I was just going to add to that, and particularly about the point on acronyms. I'm sure Umbretta is not alone in having this fatigue of these acronyms that we use. And I think it's something that I'd like us all to think about, because so often we just come out with a term like RCCE, so risk communication and community engagement, without thinking that risk communication is one thing and community engagement is another thing. And just having 4 letters to explain something which is really quite big and complex, it's simply not helpful. So why don't we just use the full sentence of exactly what it is that we want to be working on and doing, rather than just sort of trying to get our information in a short sentence on a page with 4 letters that actually don't mean anything at all. So just to add to that. Thanks.
Great. Would any of our other speakers like to add to that? Yeah, Gillian, go ahead.
Great, thank you. And thanks again to Umbretta for presenting their research on my behalf. I think what I would add to sort of the why is there a gap between we know why we're doing it and we know how to do it. And I think what came out very clearly from the research that we conducted in DRC was that the data was very valued. It was thought of very highly. But the reality is decision makers just have so many decisions to make, and they are dealing with things coming at them from every single angle. And I'm not saying that excuses not using this data as much as it should do, but I think we need to think about how to get it in front of the right eyes at the right time. It's about kind of identifying those policy window opportunities of like, okay, so this is a chance, we've collected as much as we can, we have the right, we've worked with you to develop the right recommendation, and let's see how we can work together to implement. Because I think a lot of the time it's sort of, we can't just expect that if the data is there that people will act on it. It's a process of co-development to make change, especially in an emergency setting when, you know, there's just a billion other priorities.
Great, thanks, Gillian. Michael, Raisa, did you want to add anything else into this? No, not from Michael. Raisa, from your side?
No.
Okay, great. So we had an interesting conversation going on in the chat as well around kind of the appropriate level or appropriate forms of engagement. So, you know, there is always this kind of aim to kind of move up the participation ladder or move up the engagement ladder, and whether that's appropriate in all contexts and all situations, or if there is a different style of approach that is or level of engagement that is useful during different activities. So just interested as well to hear from all of the speakers their opinions on that. I don't know who would like to go first. Maybe Raisa or Michael, if you'd like to go first this time.
I'm just kind of curious what going up, like could you just define that a bit better or more?
I don't know, Brian, are you still online? Would you like to talk through your comment?
Which comment was that? I was just reading somebody else's chat.
The one around kind of the participation ladder.
Right, yeah, well, we can give you a very good example. If you look at Washam, they do a really basic consultation exercise. It's not big community engagement. It's quick, it's fast, it gets the information that the designers need without having all this sort of co-design and things like that. So I think understanding what's appropriate for the right situation, I think is important. And also, you know, do we want to be engaged with everything? I pay my water bill. I'm not on any committees with my water sector organisation. I'm happy. So this is one of the problems with ladders, and it's not just a participation ladder. We have the same problem with sanitation ladders, that we assume that what's the top is the best. Well, in fact, it's got to be appropriate for the right situation. So yeah, does that answer that particular question? Good, right. I've got plenty more to say, but I'll stop there.
So Michael, do you have
feedback on that? Yeah, I guess I would say it depends on what you're engaging the community for. And so maybe that Channels of Hope example, if you're having, you know, with the Ebola outbreak, people burying their dead in proper ways and kind of spreading the Ebola virus, and there's also mistrust of the local government or UN, World Health Organization, then like a good approach is to go with, well, what's another trusted leader? What's another layer? Maybe it's the faith leaders to kind of step in. So yeah, I guess it depends on the topics and what you're engaging them for, if there is certain rumors or mistrust or topics. But yeah, I guess that's, I don't know what part of the ladder that is, but I guess that's most effective depending on where the community's at.
Great. Raisa, I could see you nodding along. Did you want to add anything?
No, and you have already answers as well. So I think I don't like ladders. I think we're more kind of, it also depends where you are in your programs. So often people get really stressed out at the beginning of response. We need to do community engagement and everybody needs to do their community action plan right away. It might not be appropriate. It might be just consultation at first. So trying to find when it's appropriate and what's appropriate in terms of where we are in the program. And I think you also share the link, Michelle.
I agree. I totally agree with you, Raisa. Some of what we are discussing with our teams is that way too often we are stuck in the consultation step only, and we think this is enough. And because it takes more energy and more investment in getting up into involving in decision making, collaborating in planning and rolling out activities. And we've seen that in Mozambique, we can do that. The message is we can do that in the middle of an emergency. We've done that in Mozambique, where we took the time to plan with the community in a way that was relevant to them. But then after that, our system wasn't ready to take that in. So I'm saying there are moments we can do only consultation, but we need to be aware that this is only one part of engaging the community, or one step towards engaging the community. And we need to be then intentional into moving into other ways of engaging them. It takes more time and more energy. And there is one indicator that the humanitarian system is using, for example, which is constantly below the level we want this to be, which is percentage of the people that feels engaged in decision-making processes, you know, and many countries are being assessed for that in terms of the humanitarian programming, is a proxy to say, we really not only consulted them, but listening to them, and if they feel engaged in whatever decision we're taking. Over.
Great, thank you. Any other comments on this one? I know, Raisa, you have your hand up, and Brian, are you commenting on the same question, or is it a new question?
It was just a new comment.
Okay, so Raisa, do you want to go ahead, and then Brian will come to you?
Yeah, and just to go back to what Humberto said, I think when we use a CPT in different countries, in for example in Venezuela, it was really like people and our partners and our team decided that this information, when we have done the analysis, we wanted to give this information back to communities. And it was really interesting because first of all, communities having different groups and communities having this information compiled the way we compiled it was something quite new for them. And they were saying it was triggering discussions on community action plan, etc. So I think it was a nice way of, and that was possible at that time. That was possible with our partners and our team at that moment. So pushing a little bit the community engagement through really using this information back to what they wanted to do. But yeah, that was an example, but that's not always possible everywhere. Not yet.
Thank you. Brian, do you want to go ahead? Oh, Brian, are you there? You might be on mute.
Sorry, I just managed to mute myself twice. So, I just thought it might be good to share the thing I've done in some training, which was to divide community engagement into 3 big areas, because I think that might help us categorize some of these conversations. So the first is community consultation, which is, it's the surveying, it's gathering what people think, and that has to be done with a representative sample of the population, so not everybody, and that's very much us selecting that sample to make sure it's diverse enough. The next group was some sort of community management for the ongoing operation of the WASH facility we've got, and that would have a representatives of the community, so again coming from them being representative, And then the third one is community mobilization, where you're trying to engage with the whole community to do something like behavior change. That's what I found very much when I'm talking to WASH staff, to try and understand that community engagement has these different elements, and we don't want to sort of mix up mobilization with management, and we don't want to mix up management with consultation. And consultation includes all the monitoring and feedback as well. So I thought that was quite a good way of slicing it up in a different way to the ladders. You can agree, you can disagree, but that's what I've been using for some training recently.
Great, thank you, Brian. Any thoughts on that from any of our speakers? No, maybe thinking about it for a while. Okay, we've got a few more minutes left, so there are a couple of other questions in the chat. So Joseph had asked the question about how do we manage with, oh, he's just coming back into the room now. So how can we manage with communities when we try to engage with them around perhaps a specific intervention that's beneficial for them, but they don't want that intervention? So what would be kind of the thoughts from the speakers around that question? Olivia, do you want to go ahead?
Just very briefly, I think I can just say that one of the things that we've mentioned a little bit already is the importance of engaging really early on in the process. So if you let's say go in somewhere with an idea for an intervention and go ahead and do it without having really understood what the priorities are, or the needs or the preferences are of those communities, then it's not surprising that sometimes they just aren't they don't seem desirable or don't seem quite right. And he's Joe put a couple of examples there. But if that engagement happens early enough on, and that people are involved in the planning or the design or this sort of co-design that has been talked about a little bit, then it's more likely to be deemed appropriate. Now you can't make something taste nice, for example, chlorination or something. But if there is an understanding that that the trade-off or the alternative to that thing that tastes a little bit unpleasant is something that's even worse than the bad taste, and that there's a good understanding of that, then again people are more likely to be willing to sort of adopt the behavior that you're trying to promote. Over.
Great, Gillian, go ahead.
Great, thanks. I mean, I think, all of us who've worked in this field have probably got experience, but also there's some quite good research out there about just the value of time and giving people space to ask their questions and not to be talked down to, not to be told, no, you don't understand, you don't have the scientific background to understand why this is important, but just to, sit in the round and allow people to ask their questions and to be honest about what you do and don't know. Because I think, in vaccination for Ebola, we really saw that people, they value when you tell them, look, we don't have all the answers. I can tell you what we do know. I can tell you what the science is. I can tell you that we believe that this is very beneficial and this is what we've seen. But I can't tell you that there's going to be absolutely no side effects in 15 years because we don't have that data. And I think people really value that when they're given the right to be uncertain. So I think, anyway, that was just my thought.
Great, thank you, Gillian. Michael, go ahead.
Yeah, I think if you can find people within the community that kind of what's that word, champion that type of approach, I think you could really make a difference. I think it depends who's giving the message, and if there's complete mistrust and conspiracy theories, or if it's just chlorine water and this tastes bad, but someone in the community is kind of championing it, I think it might be more effective than an INGO and someone from the outside. So if you can find someone, one person within, and really have them champion it, that can make a big difference.
Brilliant point. Raisa?
Yeah, just maybe to add on that, I mean, obviously, I sometimes find our staff very stressed because we have designed a project, we have decided, we have done some consultation, and maybe it's not like all the consultation, and we have designed something like the example taken here, and we stick to it. And obviously we're going to go through, even though maybe some people are not going to be happy. So I think also within our own team, we need to say, well, yeah, that's what we thought we were going to be doing. And actually, if you're making sure that you engage with very different people, then you might have different ideas, but also just to allow us to advocate to the donors as well, because often you write proposal and then it's set in stone forever, whereas community engagement should be the total opposite. And I think that's also something, at least I've seen in our WASH team, that we have to get a bit that understanding, and that the way we phrase proposal, the way we kind of put money for community engagement. I know it's not an activity in such, it's like an approach, but the way we give some space and maybe time as well is important, but really advocate towards donors that, yeah, I might have thought about this project, but in reality, this is not going to happen. And we're going to find some alternative together. It might take a bit more time.
Great. Thank you so much, Raisa. We're running short on time for questions. I'm aware that there is still an unanswered question from Gregory Rose in the chat box. So I don't know whether our presenters can find some time to answer that. And yeah, so like the conversation that's happening about Eyam, the plague village in the Peak District that's happening. But I just want to take this opportunity to say a huge thank you to all of our presenters, to Olivia, to Ombretta, to Gillian, Michael and Raisa, for sharing their experiences with us and answering all of your questions. We will upload the recording onto the Hygiene Promotion in Emergencies TWIG speaker series website. So you will be able to find it on there, and we will be having another webinar next month where we'll be looking at formative research for hygiene promotion. So thank you so much, everybody. Thanks for all your questions and participation. And yes, look forward to seeing you in our next speaker series event. Thanks very much.
Thanks everybody. Thanks, Michelle and Alex.
Bye.
Thanks so much.
Thanks.
Thanks all. Bye.